Hi everyone, my name is Dr. Andrew Arthur and I am an orthopedic surgeon at Twin Cities Orthopedics. I have subspecialty training in sports medicine and take care of athletes of all ages. In addition to treating common orthopedic fractures, I also perform surgery of the shoulders, hips, and knees. Today what I'd like to talk about is injuries related to biking. I'd like to talk about bike safety and biking injuries as I'm an avid biker myself. As we've all been cooped up inside due to the coronavirus, we haven't been able to get out to get our hair cut, as is obvious, but we can get outside to be biking and enjoying the spring weather. So as we get outside biking, I want to talk about some things that we can do that can keep us all safe and keep you out of the orthopedic office. As we get out on the roads and on the bike paths, bike safety is incredibly important. Some of the things to pay attention to involve, one, look at your surroundings. Put your phone away and pay attention to the world around you. The second thing is to watch out for loose gravel and sand that exist out on the roads today. That and the ever-expanding Minnesota potholes are things that you really need to be paying attention to. Probably the most important thing to do when you're out biking is to wear a helmet. Your helmet really ought to be your best friend when you're out biking and should be put on every time you get on your bike. Depending on the circumstances of the accident, we can see any and all kinds of fractures that result from falling off your bike. The most common injuries tend to be those of the upper extremity, meaning wrist fractures, elbow dislocations, and shoulder and clavicle fractures. We also will see head injuries, particularly in patients that aren't wearing their helmet. Depending on how we fall from our bike will often depend on what type of injury we have. If we fall with our hands outstretched to brace ourselves, it tends to result in wrist fractures and elbow injuries. If you tuck your shoulder and roll, you tend to see fractures of the shoulder and clavicle. In particular, I have one example of a patient that we recently treated who fell off his bike and had a very severe clavicle fracture that ended up requiring surgery. Here's a picture of his x-ray. Here's the clavicle, also known as the collarbone, that's broken right in the middle of the bone with a couple additional fragments to the fracture. What we do for that is to put a plate and screws in there that hold the bone in place and ensure proper healing to the bone. If you do fall off your bike and get injured, what are some of the things you should do? The first thing I would do is to check your helmet. If your helmet's okay and your head's okay, that's a good first step. The next thing I would do is to check the status of your bike. If your bike is severely damaged, that makes it more likely that you might be damaged as well. If you're hurt, what are some of the things you should do? Well, check your joints. Do they still move fine? Push on your bones. Does it hurt to touch any of your bones? If it hurts or you feel something wrong or out of place with your bones, that makes it more likely that something might be broken. If you do feel like something is broken, what should you do from there? I think the best advice I would give you is if you can gather yourself and get yourself together in a car, I would go to a Twin Cities Orthopedics urgent care. At a TCO urgent care, you'll see an expert right away, you'll get a timely and accurate diagnosis, and you'll know exactly what's going on.